County Live is brought to you in part by the Madison County Health Department, protecting, promoting, and improving the health of our community. The all-new Chevy Silverado, now available at Jack Burford Chevrolet and always available at jackburford.com. And by Twine Market and Design on 3rd Street in Richmond. And by kymedia.net, digital media services from top-of-the-line video production to live streaming services.
Welcome back, everyone. We are so pleased to have Kelley McBride with the Madison County Health Department joining us this evening. Kelley, thanks so much for being here.
Well, thank you, Colleen and Randy, for always having us. We appreciate you all and what you do.
Well, we appreciate you as well. And speaking of appreciation, Kelley, I know the Madison County Health Department is getting ready to celebrate quite a big birthday. Would you like to tell us about that?
Absolutely. We are reaching the milestone of 90 years serving Madison County and the surrounding area. So I'm the newbie. I have been with the health department less than a year, and I get to be the person to say, hey, look at all the great things that we've done. So that it was a monumental task, and in the middle of a pandemic, we are not going to be able to celebrate in the fine fashion that I had once envisioned. Right. But we do want to recognize that milestone. And I want to thank all three of our governments in Madison County Fiscal Court, City of Berea, and City of Richmond for helping us mark those occasions.
Wow. 90 years, Kelley. 90
yes.
years. That's incredible.
Yes. Yes, all three governments made a proclamation for August the 13th to be Madison County Health Department Day. So we're very grateful to mark that milestone. But as I mentioned, other things that are happening around us are not to be celebrated.
Sure.
We have a rise in the number of COVID cases in Madison County. It took us a while to reach 500. And now we are rapidly moving past 700 very, very shortly. So now all those cases are, not all those people are hospitalized or recovering. We have had one person who passed away. So that was a tragic loss for our community, and we pray that we don't lose anybody else. There are hundreds of cases that are recovering at home. So that is good news. However, the increase in the case count is disturbing. Our epidemiology team, in speaking to them, a comment that was made, I thought was very important. We all want normalcy back in our lives, but nothing about this is normal. Sure. So we are at a level that they consider it community spread. So we can't say, oh, there's a hot spot here, there's a hot spot there. Just consider COVID-19 being everywhere and act accordingly. Right. So in our 90 years of service, in that history, there's been a rich history of the community and the health department working together. So we are continuing to ask people to take this pandemic very seriously. It's not going away anytime soon. And to please take a personal responsibility in keeping yourself, your family, your friends, your neighbors, and your coworkers safe.
Right. And the best way to do that, Kelley, and I know exactly what you're going to say.
That we want to hear
it. Go ahead, Randy.
Especially at this time.
Well,
yes.
Yeah,
wash your hands often and thoroughly. Keep surfaces clean. Right. Keep that social distance or that physical distance of 6 feet between you and someone else in a public area. Wear a mask over your nose and under your chin.
Yes.
When as appropriate. in a public setting. Avoid large crowds, avoid large gatherings. Stay home as much as you possibly can.
Right.
And, be aware when you're around other people at work, or that you just need, if it's hard to keep that 6 foot distance, you need to wear a mask.
Right.
So, Mask Up Kentucky is launching. The governor and the state are reminding all of us to wear a mask, and that's very, very important. But it's also important to know that with community spread, there are contacts out there. So we've got hundreds of cases, but then there are going to be contacts. So more than likely, and as important as it is to continue with those precautions and those measures that we have given to people, it's important to know what to do, because more than likely you're going to be a contact. So if you are, if someone reaches out to you to say, I have tested positive for COVID-19, you are considered a contact. You will probably be getting a call from the contact tracers in Madison County. And they are not trying to get any kind of personal information. They want to know about your health and well-being and who you've been around. It is not judgmental. They want to provide people with information to help them stay healthy, and for the people that they've been in contact with to stay healthy. So if you are sick or showing symptoms, you need to isolate, and you need to contact your physician, your primary care physician, and seek medical help. And then you will need to follow the procedures to isolate yourself from anyone else. So our website, the cdc.gov website, has fabulous information. The Kentucky State website, which I know you'll be sharing in graphic. Those are great resources as well. So if you are a contact, you need to quarantine. And the rule of thumb is 14 days. That's not a magic number. It could be less, it could be more. But the incubation time for COVID-19 is several days. So, we really need to have people quarantine. And I think people feel like they're feeling better and they go back to their normal activities. So something else the contact tracers can provide to you is that information on the guidance on when to quarantine and when to come out of quarantine. So we want to follow physicians' orders explicitly on this, so we don't spread COVID-19 to anyone else.
Right, exactly right. And you know what? Speaking of wearing your mask, and you were talking about that, I see so many people wearing them below their nose. I just want to go up and go, but I know I can't do that.
Right. Well, we're counting on people to observe that about themselves. And that's exactly right. Wear the mask above the nose and below the chin. That's a good idea. Moving from 500 to 700 is a big jump.
It's a big jump.
So we need people to take this seriously and cooperate with the contact tracers. And in moving on to other things that we are doing with the health department, COVID-19, of course, is our big focus. Our community education team continues to provide great information, some first aid training, which would be Stop the Bleed training, is going to be held at Safety City. Now, it will be in person, but it will be with all COVID-19 precautions taken. There will be socially distanced. And this will be on Tuesday, August the 18th at Safety City from 1 to 2:30. And all the details are on our Facebook page.
Okay, great.
So just wanted to remind people of that.
Right. And of course, for more information, Kelley, everybody can go to your Facebook page, the website. All that information is there.
Yes, absolutely. Thank you for letting me take the time to give out this important information.
Not a problem.
Kelley, I think the information is not only important, but I think it's so important for us to thank you for being here and for sharing that. I think that the news that you have to share is difficult, but the way that the Madison County Health Department is leading during this time and the way that they've led over the past 90 years is so incredibly valuable.
Yep.
And we thank you for your time and we thank you for your service.
I appreciate your kind words. And I will say our epidemiology team are the ones who are on the front lines working hard. Everybody is under stress and out throughout the whole community.
Sure.
But in our organization, they are on the front lines working really hard. And I feel like I'm doing my part, but they're the ones that are carrying the big load right now.
Right.
Thank you so much, Kelley. Folks, we'll be right back.